Thanksgiving.
And online. You can please take your seat as we prepare to begin our program with an inauguration address by Mr. K.N. Srivastava. Sorry. So thank you all once again. We hope you find today's symposium insightful and informative. Sorry.
Who are in this field. I would only like to make some few brief comments. One is that I never knew that there's going to be so much of response. Otherwise, I would have selected some bigger venue so that more people could have been accommodated. So I would like that in future, looking at this response, your future programs would like to have at a venue which can accommodate, large number of people in the audience. The subject on which Dr. Prasad is going to speak is very relevant and very important. This neurological problems are really becoming a big, problem not only for the urban India but also for the rural areas. I come from a village in eastern UP, and I find that the kind of problem which the villages have now started experiencing on this front is really, mind-boggling. And unlike those cities, those villages do not have any kind of facilities. So I'm very happy that the Kara Foundation has undertaken this kind of initiative to help the people in every part of the country, particularly those who are residing in the far-flung areas. So without saying much, I would like to compliment Dr. Rajendra Prasad and to all the experts who are present over here for sparing their time. And let us now get on with the deliberations and hear Dr. Prasad and the experts. So thank you very much for this initiative. And as I mentioned earlier, we would like to have a much bigger event in future involving all of you. Thank you very much.
Does he have that?
Good evening, ladies and gentlemen. It's a indeed a pleasure and a privilege to be chairing this very important next 60 minutes that's going to discuss some of the most compelling issues that we are faced with, but sadly, which we fail to recognize. Pan India, we talk about 60% of our population being under the age of 30. Somewhere we forget about the 40% that are over the age of 60, and we have this aging population. The other point is the fact that most of us live in very nuclear families. A lot of our elderly population have their children who are not in this part of the world. So they live by themselves. And I managed to get some very disturbing facts about falls. Falls are actually the second leading cause of unintentional injury deaths worldwide. And each year, almost 684,000 individuals die from falls globally, which is over 80% of these are in low and middle income countries. And adults over the age of 60 suffer the greatest number of falls. It's also interesting to understand that it's not only falls. A lot of our elderly population suffer from conditions like osteoporosis, which is low calcium and vitamin D content. And a lot of them actually undergo spontaneous fractures. And case an example was my mother. She got up in the morning, she's 96 years old, went to go pick up her bottle of milk, couldn't come back. She had broken her hip. So I was out of town. I just landed in Lucknow. I took the same flight back to Delhi. We had to operate her the next day. So what I was really trying to say is awareness, being able to register their vulnerability, being able to try and control that, and measures which will help all of us to recognize that the aging population is a vulnerable population. A lot of these elderly people, when they fall, they have head injuries, and which is where neurodisabilities can manifest themselves. The last point that I like to say is in the orthopedic fraternity with hip fractures, even those that are treated, the 1-year mortality after a successful hip surgery is 43%, which is a frightening number. These are global figures and across all walks of life. So with that introduction, I'd like to hand it back to my good friend, Dr. Rajendra Prasad, just for all of you. Rajendra and me, RP as I call him, we go back almost 53 years. We did our pre-medical together, so it's been a great journey with him. Thank you, Rajendra.
So thank you all for joining us. And thank you, Mr. Srivastav. The choice wasn't given to me. It was like a show of strength. You turn up with 30 people, next time I'm going to give you a bigger hall. So I think I've got a little more than 30 for today. But next time, please do give me a bigger hall. Okay, can I have a hand mic? So I'm a theater performer. I like to stand and do this a little bit. Okay. So a little bit about myself. I'm a neurosurgeon at Apollo Hospital, and this slide gives my 4 affiliations. India International Center, of course, I'm really obliged that you've given me an opportunity to highlight this problem with the elderly. And Kara Foundation, which I formed few years ago in the memory of my father, just to promote assistive technology. Indian Head Injury Foundation, of which I'm a medical director for 15 years, just trying to promote neuro rehab. We have 3 centers. Yeah, that's what it is. So we have 3 centers in Delhi, Jodhpur, and Patna, and in Noida. It's about to start. And this is for the common man. And it's free for people below the poverty line. So those are my affiliations. And so I'll move on. Sorry. So today's topic is falls, a leading cause of disability in the elderly. I thought if I didn't mention falls, I would not get a big audience like this. So I thought, let's use a catchword, and that's falls. And as my friend Rajgopal said, that is the leading cause of problem in the elderly. So what I'm going to cover in the next 20 minutes is what are the causes of neuro disabilities, why people fall, and what kind of injuries they sustain, what can we do to prevent the injuries, and what are the solutions. So now, so I'm using WHO slide, Mr. Amil and Dr. Patanjali. These are WHO slides. I'm some form of panel with your WHO, so I can use that. So the number, more than 1 billion people in the world have disabilities, and that number is increasing because at independence, maybe our lifespan was 50 to 60 years. Now it's 80 or thereabouts. And the number is increasing. Non-communicable diseases is like stroke. That Mr. Srivastava, you asked me the other day, why are people in the villages at 40? Why are they getting strokes? I think it's a matter of research. And Mr. Ravinder from ICMR, sir, we need to take this further research into non-communicable diseases. And so if I ask for grant for research, kindly let it come through. And we are short of funds. And road traffic accidents, one every year, in that number are government figures. We all know that is recorded, but 5 times as many. This never comes out, and I have a problem with newspapers. They never mention that if 0.5 lakhs are dying, there are 5 lakhs who are being disabled, and add that to that number, and there are 1 million people every year with strokes, head injuries, and that need help. But they never talk about that. They say death. Death to ho hi gaya. So now there are different age groups. And so in young, you'll have spina bifida, cerebral palsy, autism. In the young, 20 to 40, the major cause of disability is head injuries on the road. So the government is trying to halve the number of deaths by 2030, but it's not going to succeed. So we are going to stick to the elderly. What causes disability in the elderly? Falls, stroke, mental health disease, head injuries from road accidents, and in the seniors, most of us sitting at the back seat don't wear belts, and kindly get used to it. I've got used to it. Parkinsonism, arthritis, spondylitis. So I'll just cover a few of these. So those were the figures for the world. In India, 137 million people are above 60 years of age. And WHO has included these people who need help with some form of assistive devices. Half of us have this assistive device, our glasses. Many will need many more than that. Falls and fractures. I'm sorry to say, females, you're twice as likely to get a fall and a fracture than a slot. One warning sign is recurrent falls. So yesterday I saw a patient, day before yesterday in the clinic, he said he's got this because ye dekho 3 baar gir chuke. I said, what did you do the first 2 times? We thought agle baar nahi hoga, and they didn't address. We all do. It's not them. We all. All my patients, Ashok, you will tell us later. It's not the first fall that brings somebody to attention. It's the second, third, fourth. If we were addressing this before it happened, it would get solved. Now, some of my friends would say, okay, then let's stay in bed. Let's keep Papaji in bed. Well, Papaji, if he stays in bed, he will fall more frequently because lack of exercise. If you had a viral fever and you lay in bed for a week, you'll wake up weaker. So if you're in bed for a longer period of time, your muscles and your stability would go. Dr. Rajgopal mentioned osteoporosis. I'll cover that. One thing, 2/3 of the fall, Indian statistics, happen at home. So if you don't worry what about Papaji will fall outside, just cover what's going to happen at home. And so what if you're fallen? What is the problem if you're fallen? Well, there is a problem with physical health, of course. They break a bone. There are economic consequences because many of our parents would live with us. And so therefore, the caregiver's problem, insurance doesn't cover rehabilitation and assistive devices. So, and the person is not productive. So there's a psychological impact of being senior or being isolated, because how many of you have visited a friend at home in the last 2 weeks, 3 weeks? You haven't. I haven't. So if you're isolated at home, there's going to be trauma, psychological. So Dr. Rajgopal has mentioned about fractures. That points to that even a layperson can see the fracture. That spine is fractured into 2. That hip is broken, and somebody like Dr. Rajgopal has fixed it. And so the person has been able to get out of bed. You're all familiar with the bone density scan. You don't need to look at figures. Look where that cross is. It's on the red. So you take out your bone density scan when you go home. If you hadn't had it done, get it done. And if that cross is below the red line or even in the yellow line, you need attention. So osteoporosis, more in the elderly, 36%, women and elderly. Dr. Rajgopal mentioned vitamin D deficiency, early menopause. There's a genetic predisposition of Indians to get osteoporosis. And there's a lack of diagnostic facilities. Even those of us who have the facility don't get it. So you need to get your bone density done, and you need to be aware that you're genetically predisposed. And yeah, that's a blood clot in the brain. What happens? That's how we scoop it out. I'm sorry if it's repulsive to some people, but I think it looks nice. There's that blood clot being taken away from the brain. And that's a spine fracture. This is something I do. A lot of us, including me, are on blood thinners. I'm really, really careful of preventing falls. So if you have a fall and you're on blood thinner or anticoagulant, a minor injury will become a major injury. So most seniors, even now, prophylactically, oh, up 60 ho gaye, you're hypertensive, go on aspirin. That's no longer true. That should not be done. You have to have a brain reason or a heart reason. You may be in for a stroke or a heart attack. Only then should you be on aspirin. Otherwise, you will fall and have a major injury. So what's the problem? I'll lie in bed. Well, if you lie in bed, and orthopedics know, even his mother, Dr. Rajgopal's mother at 96, why did he operate? Because he wants to get her back on her as quickly as possible. Lying in bed will cause deep vein thrombosis, clot in the leg, goes to the lung. You have pneumonia, bed sore. It's a vicious circle. The longer you lie in bed, the muscles will get weaker. And you depend on caregivers, which is difficult nowadays, and social isolation. So what are the 5 preventive things I want to highlight? Make your home safe. What can a layperson do? Make your home safe. Get your eyes checked. Get your health checked. Get your medication reviewed. Stay active. And use neuro rehab and assistive technology. So I'll cover very briefly, 1 minute each on each of these points. So, it's very nice to have all the nice things around you, but if it causes a clutter on the way to the bathroom, on the way to the stairs, you may fall. So that house is cluttered. It needs to be decluttered. And this bed is not only for hospitals. Okay, I've used it for family members at home because when I go to sleep, I worry, will they fall? And this is available on rent. You can buy it for 1.5 lakhs, 2 lakhs, but bed with railing is an essential part of an elder's looking after, because you wouldn't want your dear ones to be tied and restrained while you sleep. One time you will sleep, something will happen. So bed railings are a must. Now, the important part. Even in our house, we found we had railings on one side, and my mother would say, "Dono side rehta to acha rehta," because I'm very scared I may fall. Even 4 steps, my mother, she pointed out every time that I don't think it's safe. Then commodes, all our WCs, for some reason, are meant for people with strong legs that you can get up. You need a good hip flexion to get up from the chair. If your commode is low, you'll stumble and fall. And therefore, you need attachments to go on the commode so that you're almost in a about to get up position. And there have to be railings on the side. In the bath area, there has to be railings, there have to be mats outside, and you need to be sitting. And if you can't do all that, then get a commode chair. So one of my family members is at home with me. I can't take her to the bathroom for the shower because the bathroom doors aren't meant for wheelchair. So we can have your house checked, and we can her own team here, Kara and Indian Head Injury Foundation. You can send us pictures. If wheelchair can't enter your bathroom, can you imagine an elderly person would have a big struggle, believe me. And then there is this watch, which my son just said, "Oh, you're talking about all this and you're not talking about this new Google Watch." I said, "Acha, jaldi bhejo." So 5 minutes ago, we put this on. This Google Watch and others, they alarm you. So if you put this on to your senior and for 30 seconds, they don't move, it will send you an alarm. He will send the alarm, or the watch itself will dial an emergency number. I think it's fantastic, because at 2 in the morning, when you have fallen in the bathroom, there ought to be a phone in the bathroom, but if you're on the floor, you won't get to that phone. But if you have a wristwatch and you're sitting, like all American, a lot of our NRI children, they're sitting in New York, they can say, Papa ji has fallen down, let's do something within 30 seconds. So, and the carpet. How often have we nearly slipped on carpet's edges? So we need to be sure that loose carpets are not near elderly people where they are going to walk. Next, number 2. There are only 5 points, so bear with me. Number 2, 1/3 of people, and Dr. Rao here will talk about elderly and the vision, 1/3 have problems. And these are common problems: cataract, glaucoma, age-related macular degeneration. And more importantly, you lose your peripheral vision, and Dr. Patanjali is an eye surgeon, and you lose your adjustment to light. So if you're 70, you get out of bed and rush to the bathroom, "Arey, humne light jala diya," but your adjustment to light will take time. Your adjustment to distance will take time. You don't know where your foot is going. So with vision, and then there's diabetes, which 1/3 of the country has or will have, and then 1/3 of people will have diabetic changes in the eye. So eyes are a major problem, and therefore I've called from IIT Professor Rao, whose major work is in vision. So number 3, health checkup. Why is health checkup important? Because all these will cause weakness, cardiac problems, hypothyroid. Your thyroid level has to be proper, osteoporosis, diabetes, hypertension. So when I see a person in my clinic and I can't see them getting up from a chair, I said, "Aapko proximal muscle weakness hai? Have you got your thyroid checked? What is your HbA1c?" Because those, forget your MRI. I just said MRI mein dikh jayega. I said MRI mein nahi dikhega ki aapki leg weak hai because of thyroid or diabetes or stuff like that. The other thing which in my research, I had to do a bit of research to come here. And I found that anybody who's on more than 4 drugs, so statistically it's been proven that if you're on more than 4 drugs, you're an elderly, there's a higher chance of you falling. So your drug combination needs to be checked. And everybody goes to this doctor and says, "Pain ho raha, bola gabapentin de do, triptomar de do, ye sab de do." But they don't realize that when you're senior and a male, you're already getting up 3 times to go to the bathroom. So if you're getting up 3 times and you're on painkillers, and Ultraset, everybody knows Ultraset. You've heard of Ultraset? Well, that has tramadol. That's an opioid. So you're on an opioid. You can't see properly because it's dark. Your muscles are weak. This is a recipe for disaster. And so get your medicine checked and say, "Listen, if I want to take my painkillers or whatever, I'll take it at 5 in the evening or 6 in the evening, not at 10 in the night." And then there's something called postural hypotension. We want to jump out of bed. Postural hypotension is ki chakkar aa gaya, suddenly you're standing. There's nothing wrong with you, except that you need to maybe get your medicine checked, and you take your time getting out of bed. And most of all, I go to my pharmacy in my colony. So often the guy comes up, "Arey yaar, lag raha hai blood pressure badha hai, kuch dawa de do." And the guy just gives it. And then I have a major fight with him. "Arey, what the hell?" And so painkillers are dispensed, blood pressure medicine. Why? Why should I give $200 to a doctor, or in Dr. Rajgopal's case, a bit more, to get his consultation? Arey pharmacy ko bolo, ₹200 mein to dawa bhi aa jayega. So avoid self-medication. And as I said, sedentary had more falls. So in my research, I found that in US, if like Tarun Lala here, head of neuro rehab at Max, they do RWA, they bring screening to the RWA and find who are susceptible. So in US, Tai Chi and yoga, that is given as a sole intervention, right? So if you're not osteoporotic, if you're not hypothyroid, if your vision is fine, all that, but you may still fall. So Tai Chi is really good. And I will take to that. Ashok, you'll join me as well. Yeah, you live nearby. So I'll join you and you take lessons. And so it's something to do as a group. So it does a community, it does a group activity as well as help prevent falls. And one thing, so why is neuro rehab important? And a lot of seniors, they want to get back to their life. They want to drive. Now, I just got a few months ago, Hemant, you know this gentleman in England, an Indian guy who fell out of a taxi in London trying to just get out of a car. So it's not only driving. Is this person safe to get into the driver's seat and safe to get out? Because a lot of falls happen in and out of chairs. So getting back to your normal, and that lady there, she's a fellow Rotarian. It's important to her to join her club and to go there and play cards. So social integration for quality of life is what is important. So rehab starts in the hospital. I have permission from all these people, by the way, to show them. So it can happen in the hospital, and then you move to a home rehab, and then you do a community rehab. Head Injury Foundation, we've done about 1,000 sessions during COVID, tele rehab at home during COVID. So the last few slides is about assistive devices. So you can have walking problem for mobility, you may have vision problem, and you may have activities of daily living. So various kind of walkers. Most seniors, they'll do everything you say, but they won't take a walker. They won't take a stick. Main theek hu. And so there are various kind of walkers, and you need to insist on your family member to have walkers. Now, the middle walker, you need strong hands. If you don't have strong hands, you need what's called a gutter walker. Can you run that? So this man's hands are weak and the legs are weak. So he can't walk with an ordinary walker. He can't use a stick. He needs to rest his arm on a gutter walker. So who will tell you what you need is a neuro rehab professional. That do you need this walker or that walker? Next, please. And through our Head Injury Foundation and CARA, we've distributed a lot of wheelchairs. And thanks to WHO, we've started this program in Patna. But then we realized that by setting up a rehab center for distributing WHO wheelchair, that wasn't okay because people were coming from Ara, Darbhanga, Samastipur. So imagine if you're poor, you're disabled, I'm making them come 50 times. So we've started a project of doing tele-assessment. So we now, most people have smartphones, we assess them at home, and then we give them a customized wheelchair. That is an IIT Chennai invention, where on an ordinary wheelchair, they put a motorized attachment. So these people can go out on a motorbike, wheelchair gets attached, and they go out and they can do whatever. So according to WHO, we do these 6 measurements. I didn't know myself till a few years ago that I thought I just go to Lajpat, I would tell my patient, Yusuf Sarai jao, wheelchair le lo. And then I realized it's like go and buy a size 9 shoe for everybody. The wheelchair needs to fit you. So many seniors say wheelchair mila, but acha nahi laga. Kyun nahi laga? Because these 6 measurements were not taken and did not fit that person. Now there's some activities of daily living, and I just want to point out, and I've got it specially for this. If your hands are weak, and you'll be scared to give the senior a cup with only one. So these simple things like a cup, I got this from the market nearby with 2 attachments, and then he can do. It doesn't help to keep feeding somebody and giving him a drink. If you have a cup with attachments, maybe, and something cold, you can start by that. So this is simple, a cup with that. Then attachment for spoon, for brush. So this can be a longer handle. His hand isn't coming to his teeth. You give this. I got this from the AC repair shop, a rubber pipe. Put this in. You can do that. For buttons, this can, if you can't. So the first thing with somebody with a cervical problem and hand weakness senior, he said, button nahi lag raha hai or roti nahi tod pa rahe. Well, the button can be sorted out by something like this. He can pull and put the button. Similarly with the spoon, you can have a larger attachment, and from here itself, they can be fed. So devices need not be expensive, or this belly attachment. So a plate, if he's got something on the side to hold, then he doesn't need somebody to hold his plate. He can put his finger around this and hold. So what I want to say is assistive devices don't have to be robots. It can be very simple things. Sorry. And then, yeah, so next, I'm open. So, and then for glasses, a few words will Dr. Rao, but simple thing like getting your eyes checked can solve a lot of eye problems. That smart cane, steam it, and words about that. Next. And then there's a lot of things on the where voice text to voice, and you need to alerting devices. That's all on your phone, but you need to know about it. Next, please. I use this because I often turn and ask, "Acha, आज Monday है कि Tuesday है? दवा खाया कि नहीं खाया?" And then that box helps. So if you don't have it, you must have this pill dispenser that will tell you it's Monday and you haven't had your tablets, or Tuesday. Video calls, all these, those are card attachments for people who can't use their hands properly, want to pay cards. You need to be doing crosswords. You need your mental exercise. Next. And this, I want to show you the small video that even at rehab, at our rehab center, we make exercise fun, right? So if you tell a person, हाथ का exercise करो, ये dumbbell है, करते रहो, they're not going to do it. So now just see the video of this man. You can see, no, just do that lady. So this man has hand weakness. Now look at that video, if you can enlarge it. She's been told her leg is weak. You exercise your leg and you're supposed to move that basket while that fruit is falling. It's not very clear here, it's not large, but basically, so she's getting mental rehab, cognitive rehab, as well as her paralyzed leg, she's moving. So there's a lot of stuff that's available at centers, as well as gait trainer, balance trainer. This is at our Head Injury Foundation Center. You can improve your balance if you go to Lajpat, to our center, or to the new center there. So why is it not available? Because there's no awareness, even among healthcare professionals. You ask a physio, kahan jaye? He'll say, I don't know, kahan jao. Kahan milega? I don't know, kahan jao. And then there is the importance, if you tell the senior, there's no use. You have to teach the caregiver. How do you look after? Because in spite of a caregiver, my family member fell and repeatedly fell. Ki sir, wo to ab kya kare? Maji hil gayi, gir gayi, ye kari. So the caregiver needs to be taught how to get this person out of bed, how to feed that, and how to bathe. That will be my next program, will be on caregivers. It's the focus on caregivers. And a major area of inclusion is the internet. We have used it widely to monitor senior people and to give tele-rehab. But one very interesting thing, that over COVID, we had so many people who need rehab and so few people to give rehab, like therapists. So some lower limb cutting, and she got 15 of these ladies together, and then they were exercising together. So, okay, next. So they're trying to tell me to stop. I will really. And so what do you need to do in your colony? You need to have screening. You need to have screening, and you need all that, and you need to train people under one roof. And if you help me, we can have such a center for assistive technology in Delhi. We have it in Patna, Mr. Hamil, you visited that. That's just the start. It's just a small thing. With your help of WHO, we started. We need something in Delhi where all technology is under one roof. So the reason for doing it here in IIC is that people should take notice and give us help. Next. And so we need a center where the doctor, the scientist, the IIT guys, the family member, everybody is working to have a specific solution for one person. And that we have. We have the Head Injury Foundation, Kara, all of this, all the people here. Next. They are here today as panelists because they are personally committed. So in conclusion, elderly contribute to a significant number of people with disabilities. Fall result in a significant number of disabilities. There are neuro rehab and AT solutions. We must screen people. Next. And fall prevention is multifaceted. It's not just go and get your eyes checked, go and get your medicine. Everything has to be done together if you want somebody to not fall. And caregiver's role is important. Sir, Dr. Ravinder from ICMR, I think you need to bring attention to the government that an integrated elderly program for the elderly, where prevention, cure, and rehab has to be together. It's in all over the world. And there, in our hospital, Apollo, we have 400 doctors. There's only one geriatric doctor. I asked Dr. Sharma, आप आएंगे? He said, मेरा टेक्स्ट बुक पढ़ लो, मैंने एक पूरा चैप्टर लिखा है, fall in the elderly. So I said, sir, हम पढ़ के फिर अगले बार आपको बुलाएंगे. And so there are chapters and chapters written. So I want to thank you all, and I want to thank the people who are online. And what we want is, I would like a little introduction next. I've saved the best for last. And normally, you know, koi medical presentation hota hai, then they say, any conflict of interest, you know, is there any financial? So I have none. I have no financial interest in the elderly, but I do have one conflict of interest. All the panelists are close to me. That is my conflict of interest. Okay, Dr. Srivastav, he is a fellow Bhojpuri speaking person. So he is close to me. Ashok Rajgopal, as you mentioned, we were together in college. You were brilliant then, and your whole career I've followed. You're brilliant. And you continue to inspire us. He's now into music. Those who want to share his video, he's a fantastic organ player, and he will share it with you. But Ashok, you were brilliant then and used to wake me up and say, chal yaar, class chalte hain. So, you know, that difference has remained. You remained brilliant, and I've stayed where I was. I need to be woken up. Dr. Patanjali Nair, 5 years ago, you said, Geneva chalte. And I said, chalo chalte yaar, Geneva, who doesn't want? But then you started me on that path of neuro rehab as WHO and assisted. And you know, when I'll give you a bit of advice, when you go to somebody, invite somebody to a conference, you give him a notepad. I was mentioning to you, Ashok, jahan ye le gaye hain as WHO, he gives me a notepad, ki you make a very nice summary. Can you listen to all the lectures? And next morning at 8 o'clock, could you give a summary? So what happens was, I'm attending all the lectures. I don't have the whiskey in the night. And at 8 in the morning, this guy wants a summary. And then he's kind enough to say, Aapne bahut acha summary banaya. I said, sir, please give it to somebody else. And then Professor Rao, a truly inspiring work from IIT. When I speak abroad, and I have done, I'm not showing off, but I have spoken abroad. And when I saw that, I was at the University College of Zurich last month, and I told them about the work they do, totally amazed. They don't know what is happening in India. And when the Prime Minister goes, he takes your invention, that smart cane, and he gives it all over the world. You're an extremely humble man, but you're a great, great scientist. So now, you know, we all know that collar chahiye, belt chahiye, but the government wants to know where should the belt be, where should the wheelchair be, where should what be. Dr. Ravinder of ICMR, he has been given the task that the government wants to know, make a priority product list that the poor below poverty line can get this, so the government can. So you very kindly have invited me on that panel. Please invite Dr. Rajgopal, a lot of experience on orthopedic orthosis. He can help you as well, but thank you, sir. Mr. Ramil, specifically WHO has given importance to assistive technology. And so he's been posted. He's got a wide range of experience at WHO regional office for 11 countries. How do we promote these technologies in 11 countries? You're responsible. And thank you, sir, for visiting our center in Patna. And there were a few flaws, and we have corrected those. So please come and visit us, and you'll be better. Tarun Lala has been with me for 20 years, first at Apollo and now at Max. And I've seen you grow, Tarun, promoting rehab. And you've been an advisor to Head Injury Foundation, honorary advisor. It's really amazing. Because people like you, and you brought a lot of your students here, they need to spread the word around. So now we'll have a few words from Ashok. Have you spoken, or do you want to say something else? Huh? Ashok, do you want to say something else? And
So
then we'll
just
move
a
from
very
one
quick
panelist to the other,
snapshot of.
and then we'll go to the question.
Yeah, so I think that was a very eloquent exposition of everything that that is currently available, that needs to be addressed. Just a couple of points, you know, sort of picking on and taking Rajinder's points across. There's some very simple measures that we can do. Again, going back to my orthopedic sort of bias, the biggest source, in every OPD, elderly people come and say, Doctor, sab calcium nahi likha, aapne vitamin D nahi likha. You don't need to take vitamin D or calcium. Go out into the sun 15 minutes, you get all the calcium you need. That's all you need to do. In the summers, we find it too hot. In the winters, we find it too cold. So both ways, we stay at home. So we don't really get our dose of vitamin D. That's all you need to do. Believe me, 20 minutes in the sunshine. Diabetes, 67% of Indians are diabetics. We are the diabetes capital of the world. Thyroid, we are about the third largest population of thyroid patients. There's a very interesting phenomenon, which just a bit of trivia. We're actually different in heights when we go to sleep at night and when we get up in the morning. We're actually shorter. Uh, at night when we go to bed, we are actually taller when we come out of bed. That's a philosophy that's called the Wolff's Law. And the bones are not actually solid organs, they're actually pliable, they're like plastic. The other point that Rajendra mentioned, very important, is anticoagulants. Just about everybody is doled out with aspirins. These cause spontaneous bleeds, whiplash injuries, seat belts, very important. And again, the point I'd like to reiterate, so a lot of what I'm saying is repetition of what Rajendra's mentioned. Our elderly population, for whatever reason, even at 90, don't want to take a stick. It is for their safety, and it is very important that they use it. Washrooms are the biggest area. Carpets, washrooms, and cords are the things at home that cause falls. So you need to make it safe for them. And today, with the technology, with friends from IIT, the brilliant minds that we have, you can actually have smartphones. You can have areas that people outside of your workspace or your home space can actually be watching over you. And the last point is inside washrooms, particularly in the vulnerable population, like we have in hospitals, a little cord or a bell that actually sounds an alarm in the event that anybody has a fall is just a way to keep our elderly population safe. And we know if they're in trouble. Oftentimes, the washrooms are locked and they fall, and they're able to access these cords. They just need to pull, and it sets off an alarm. It gives somebody outside the knowledge that there is a trouble or a medical emergency. That's all I have to add.
Thank you so much. Person speaking loud to a senior. Acha, he said, I'm old, but I'm not deaf. And so that is our attitude towards seniors. And my friend is a very compassionate person. So I'll start from this end, and Dr. Patanjali, you will summarize like you have given me. We're going to go along, and then you just give a take-home message, and then we'll take comments from the audience. So may I have Professor Rao?
Good evening and namaskar. And I think thanks for this opportunity. I'll just spend a minute on elderly and minute on our assistive technology work. So one thing, it was an excellent lecture on falls. But I think I also have my colleague here, Dr. Gaurabkar, and his area is designing for elderly. That means if you can actually design the spaces, products, and processes which are elderly friendly, probably in many cases you don't have to discuss about the falls. So I think what we generally do is that whenever, even in our homes, if you have like 3 bedrooms, they are same for all. If somebody is elderly staying, you can actually do many things which are elderly friendly. And I think that's what he does. I thought design is another very strong weapon to actually take care of, which actually prevents. Like prevention is better than cure is the biggest message. But coming from a technology institute, as it was mentioned, there are a number of technology tools which are available now, particularly both to prevent the falls, to detect the falls, and also to reduce the injuries. For example, mentioned about the belt. In fact, if you go to Amazon, you can actually buy a hip protection underwear, which is available. But only thing is people have to overcome their stigma in order to wear this, which is actually a kind of a thing. But coming to what we do at IIT Delhi, for last 15 years, we are actually developing assistive technologies for visually blind. Okay. And we have about 6 products. Usually educational institutes do research or do proof of concept, but I think we take products all the way to market. So we have like more than 200,000 users in 35 countries of these products, which we do. And I think one of the things which was mentioned was a vision is a very important, because a lot of these assistive technologies are not only meant for people who are visually blind, but they are extensively used by the people who are elderly also. For example, we have 3 products in the space of mobility, and all of them are used by this thing. Just to give one example, like we have a solution where somebody goes to a, let's say, a major place like a building and would like to go to a room number 605. And you probably both visually blind person, sometimes elderly also need a help to reach. But I think we do have a mobile app which actually takes you to a specific location by step-by-step instructions, which you can use to do this particular aspect. So in fact, we have now put this in All India Institute of Medical Sciences. We have actually put it in Kamala Nehru College in Delhi, which has large number of blind students and faculty. So these tools are now, because this is something which can be used by sighted, it can be used by elderly, it can be used by low vision, it can be used by people who are not literate, it can be used by anybody. It's a single app, so it's a something which you can do. We also have a similar solutions. In fact, if you have a time, you should visit IIT. We have a place called Experience Zone, where we have kept 200 assistive technologies which are used by people who are visually blind, kind of a thing. This is probably a single place where people can come. We have thousands of users, teachers, and other rehabilitation personnel who visit regularly to see. This is in IIT Delhi. It's called as a. It is actually built with the help of ICMR. ICMR has given us what is called as National Center for Assistive Health Technology. So under that umbrella, so I think funding comes from ICMR, you were saying. So here is an example where ICMR actually funds. But I think this is a very unique type of a solution, or you can say place where you can see, and many of them are actually used by elderly also. Maybe when you come, you can also have a look at. So generally, I think, so IITs are, though we have official timing from 9 to 5:30, but I think, educational institutes are 24/7. If you say if you're coming, we'll open anytime.
So I think we'll share the presentation of today and the contact number of all our panelists, and you can do a one-to-one with them whenever. So we'll send a diary around and you can sign that. Thank you.
a wonderful idea.
Yeah.
So, thank you.
It is called Experience Zone, which is
Just like the new Apple Store has an experience zone, you'll have a similar one.
So we have actually, in fact, multiple IITs are working. IIT Madras has created similar experience zone for products which are related to mobility. For example, they have a wheelchair skills training, etc., which are there. Delhi Center is for visual disability. And I think we are now adding another 50 low vision products, and we'll also expand into it.
They have developed a, something like pen drive. So it is put near the specs, and a visually impaired person can see.
This thing. So there are actually 3 such products in the market. In fact, you can see 2 of those products also in our lab, which is there. One is called RCAM, second is called Seeing AI. These are products which are available. But I think looking at the time, probably we'll have larger discussion sometime.
So we'll have a full meeting on assistive devices. And if you sign your name, we'll let you know when we have our next meeting. Thank you, Professor Rao. Thank you very much and for your comment. Okay, Mr. Amil, what is WHO doing about this?
Now, before WHO, I come to WHO first. Let me congratulate you for such a insightful presentation that you made. It actually it was really interesting, and thanks for bringing this crowd together. You definitely deserve a bigger room. And next time, if you don't get here, perhaps we can try and look for a WHO room. My colleague.
No, we provided. No, yeah.
No, just kidding. On a lighter note, my colleague Dr. Ashil is also here from the WHO country office. He's a very, very knowledgeable and experienced person in this area. I'm not sure if we'll have time today, but if we do have, he should also get an opportunity to speak, brings in a great experience with him. Maybe I'll just start with my personal experience on falls. My mother-in-law just arrived in Gurgaon to stay with us for a while. But she comes from Raebareli, where there's a lot of fluoride content in the water. So osteoporosis is one of the biggest problems, and she's had multiple falls. And one of the biggest reasons is what you showed on your slide, not having grab bars in the washrooms. Although in those cities, you have the luxury of having a bathroom as big as our bedrooms in Gurgaon. So, but still, you don't sort of design it in a way that it is safe for the elderly. So I think that's a very, very important point. All of us have faced it. But imagine she's just one woman. And globally, 2.5 billion people need assistive technologies. That's every third person in the world needs assistive technology. It's a huge number, every third person. And what it says is all of us at some point of time, maybe for a shorter period or longer period, will need at one point of time an assistive technology. If I'm not using today, I will definitely most probably need it tomorrow, but I am actually using it today. So this is one common example. And access, as he rightly mentioned, "Mujhe nahi pata kahan milega," is such a common thing. Our global report on assistive technology said that in high income countries, the access is as good as 80%, 90%. For example, in Switzerland and all, it's also covered under insurance. But in low middle income countries, it's as low as 10%, and low income countries, it's as low as 3%. Imagine access of just 3%. So we definitely need to work on a lot of awareness and those things. And oh, sure. And one of the important things that WHO and UN agencies that speak about is sustainable development goals. I'm sure all of us know of SDGs, sustainable. But how do we ensure SDGs if we don't go by its principle, the main principle, leave no one behind? And we are actually leaving a lot of people behind if we are not ensuring that they have access to affordable quality assistive products. And that is one important thing, a take away point that we all need to think of. How can we do that? How can we make the society inclusive? Because 80 today we are talking about elderly, but it starts from a child. Had I not been given my spectacles in class 10th, I started using it during my pre-board exam, I still remember. I wouldn't have been able to complete my studies as well I've been able to do it. Imagine from that age till today, or even assistive technology has played such an important role in not only my life, but also little things that I'll do in my life, that kind of contribution. Uh, you very rightly mentioned some of the barriers. One of the biggest barriers, the lack of awareness. And I must say, my senior colleague, Dr. Patanjali Nair, did some wonderful work around that on awareness. What he supported about 5 countries in our region, and more than those centers in the region, to set up demonstration centers. So I'll take examples of the work that he did in India, but although he did beyond that as well in Nepal, in Myanmar, in Maldives, and so many other countries. But in India, he chose few centers like the RP Center of AIMS, the Kara Foundation in Patna, CMC Vellore. And based on some thematic themes, he or just what Dr. Professor Rao and Dr. Ravinder were mentioning, created those experiential centers so that you can close the gap between the need and the demand triad. Because at times the need is not real, because you don't know actually what you need until you know what's available. So, for example, I would never want to buy a mobile phone unless I know that a mobile phone exists. somebody needs to tell me, okay, such a simple thing exists, why don't you buy it? So he set up those centers, and RP center and the CMC Vellore, they're doing some wonderful work. There's barriers around stigma that we need to work on. How can we all talk more about this and remove the stigma barriers? The other important thing is, and there are definitely many barriers, but yes, definitely. Yeah, sure. So perhaps I would pass it on to my next speaker, Dr. Aminda, if you want to. Yeah, thanks.
Thank you and namaskar. A very good evening to all of you. I must congratulate Dr. Rajendra Prasad for organizing this wonderful program here today evening. False and assistive technologies are, very important a topic for health professionals, for the social scientists and social activists rather. तो मैं जैसे उन्होंने बताया मेरे को उस दिन कि हम एक प्रोग्राम कर रहे हैं, so I said I'll come definitely. I just want to share few incidents. I don't want to go into the figures. Emil has already shared that 1/3 of the population need assistive product at any given point of time. All of us we need throughout our life. But I'll say right now we are all of us we are using assistive technology. Chair. So without that we cannot survive. एक न्यूरोसर्जन से मेरी बात हो रही थी एम्स में, तो हाउ वी हैव लैकिंग दीज सिस्टम्स. तो मेरे को कहते रविंद्र आई वांट टू डू समथिंग. मैंने कहा सर आपके डिपार्टमेंट में न्यूरो रिहैबिलिटेशन, न्यूरोसर्जन है तो न्यूरो रिहैबिलिटेशन डिपार्टमेंट तो होगा एम्स में. एपेक्स इंस्टीट्यूट है, सबसे बड़ा इंस्टीट्यूट है. कहते नहीं. मैंने कहा मतलब रीजन, कहते वी हैव नेवर थॉट ऑफ. मैंने कहा आप पेशेंट को कितने दिन रखते हो? कहते 5 या 6 दिन रखते हैं हम, उसके बाद हम उनको मतलब डिस्चार्ज कर देते हैं. उसके बाद मैंने क्या होता है? कहते पता नहीं हमें क्या होता है. सो it's a reality. And I told him, can you do it? He said, will you support it? I said, definitely I am going to support it. He said, from today onward, my only aim till I'm alive will be creation of neuro rehab department in AIIMS. I said, not only that, you have to create in all the departments. So while similarly we were talking to Ministry of Health, कोई मेरा ख्याल है 20-25 प्रोग्राम है नेशनल हेल्थ प्रोग्राम, और सारे प्रोग्राम में उन्होंने क्या किया हुआ है? उन्होंने लिखा है प्रिवेंशन एंड कंट्रोल ऑफ समथिंग समथिंग. They forgot, I think nobody told them that rehabilitation and assistive technology is also there. So yesterday only I finished my paper where I identified 15 programs where assistive product and rehabilitation is required strongly. So I'm going to send it to the Ministry of Health. मैं एक मीटिंग में गया, वहां पे मेरे से पहले एक मिनिस्ट्री ऑफ हेल्थ के जो डेफनेस प्रोग्राम देखते हैं, उन्होंने फिगर दिया कि हमने इस साल में 13,000 हियरिंग एड दिए. मैंने उनको पूछा कि हमारा एक स्टडी है आईसीएमआर की जिसमें हमने देखा कि 6% पॉपुलेशन में हियरिंग इम्पेयरमेंट है, और उसमें से चलो 6% ही तो 1% लगाओ. 1% 140 का 14 करोड़ हो जाएगा मेरा ख्याल, नहीं 1.4 करोड़. तो 1,40,00,000 लोगों में डेफनेस 50 लाख लगा लो, इतने में हीरिंग एड की जरूरत है, और आपने दिए 13,000. तो कितना गैप है? क्या आप 2030 तक सस्टेनेबल डेवलपमेंट गोल या सबको दे सकते हो? नो. आपने कभी सोचा भी नहीं. सो यू हैव टू चेंज द वे यू आर डूइंग राइट नाउ. ही एग्रीड. नेशनल लिस्ट की बात करी डॉक्टर राजेंद्र ने, उसके लिए हमने 380 प्रोडक्ट आइडेंटिफाई किए 2-3 साल पहले. उसके लिए भी काफी हमें क्रिटिसिज्म हुआ, बट टेक्नोलॉजी कितनी फास्ट बदल रही है मैं उसके बारे में बताऊंगा. कि उसमें से अभी हमने जब लेटेस्ट मीटिंग करी तो उसमें हमें एक्सपर्ट्स ने बताया कि इसमें से 30 प्रोडक्ट ऑब्सोलीट हो गए विद इन 4 ईयर्स. और उन्होंने कहा कि उसके लिए एक ऐप, सिंगल ऐप, वो 20-30 प्रोडक्ट्स के लिए आप एक ऐप यूज करके आप यू कैन मतलब चेंज द लाइफ। सो हमने कहा ठीक है, अब तो हमने बना दिया, बट हम वेरी शॉर्टली वी आर गोइंग टू रिवाइज इट। आई विल स्टॉप विद वन लास्ट स्टेटमेंट। CC प्रोडक्ट का करते करते हमें वी वेंट टू द PMO, नाउ द प्रोजेक्ट इज लाइंग देयर। तो मेरे को वहां से फोन आया PMO से, उन्होंने पूछा कि इसकी नीड क्या है, इसके लिए हमारी तैयारी क्या है। तो आई टोल्ड देम दैट दिस इज नो हेल्थ प्रोडक्ट। दे सेड वी थॉट दैट इट इज सोशल वेलफेयर प्रोडक्ट which is under Ministry of Social Justice. I said, no, this is under Ministry of Health. This can be under Social Justice or Ministry of Health. So now a huge project, they have taken it up, and every day we are feeding to them. And just now while coming here, I also got the call that we have to give them कि इंडिया में कितना मैन्युफैक्चरिंग हो रहा है, कितनी बाहर से आ रही है, और हमारा स्टेटस क्या है। So the our voice has reached the top, and very shortly we are expecting a big package announcement by Honorable Prime Minister, and I hope we all get that benefit of that.
Thank you.
Thank you.
Dr.
Thank you.
Ravinder. Now we all know somebody who has access straight to the PMO. So his number is going to be shared. So last word from Dr. Tarun Lala,
Yeah.
and then Dr. Patanjali Nair will say, summarize and take some questions before we wrap up at 7:40.
Why question, why not the solutions? Only not the question. There should be solutions to the
Yes,
problem.
there will be questions.
And solutions, questions and solutions.
Okay.
Tarun,
Yeah,
will you-
yeah. So I just like to add
So
to this.
everybody should not be ready for the
Yeah,
question.
so I just like to add with
So
just
they're just finishing and then we'll take your question.
just a line more to this, so fall assessment is very important. What we all spoke about, ki ek ghar mein if there's a fall, so there was a history of fall. So, we need to realize and, immediately reach out to our physician or to any physical therapist that where you can get a fall assessment. And then those guys will tell you how you can prevent it. So prevention better than cure, so that, agla fall na ho. So there, I'm sure आप लोगों ने देखा होगा, there are many patients, आप उनको बोलते हैं कि एक walker लेना, somebody will tell एक walker ले लो. Doctor is not telling you. आपके अपने ही family members they say यार उनको योगा, आप उनको walker दे दो, हमारे घर में भी है. And the patient is actually holding the walker and walking. Is not putting the walker on the ground. वो हवा में ही लेके चल रहे हैं. So that's a tragedy. अब किसी को बोलते हैं stick ले रहे, वो हवा में stick लेके चल रहे हैं, वो कहते हैं हमको जरूरत ही नहीं. So that assessment is very important. So my request again is reach out to your therapist. It can be one of the IHF centers or any of the Max hospitals or at Apollo. Please reach out to us. Thank you.
Thank you very much. And I think he's granted me 3 minutes, but I'll try to use 30 seconds from them to tell that each and every word Dr. Rajinder spoke about how he took the notes was absolutely correct. Absolutely correct and divine in the sense that's how our friendship grew. Ashil, we were in a quandary. It was a meeting in Jakarta, that how do we involve a very senior person, neurosurgeon come. We don't want lectures from him. How do we involve him? So the best thing we thought is ask him to take notes and summarize. And he did that very well. And he has brought it in every meeting subsequently. And I think he really liked it so much that he has given the task to me. It's the most important here. So I acknowledge that. It's a very difficult task to Dr. Rao and Dr. Rajgopal to summarize what all has come through, but I'll see 4 or 5 points, which I think from every one of yours coming. First of all, from you, sir, Dr. Rajgopal, we talked about 40% of the population is above the age of 60. That's the first thing, a problem statement. If you don't say problem statement, status, that there's such a huge population. Second is 80% of deaths from falls are in the LMICs, the lower middle income countries. That's very important for us, Ashil. Then we have the awareness of the vulnerability. Okay, these are the numbers, but the awareness of the vulnerability is one of the most important things. And I think I don't see people sitting here just as they're the consumers of today's function. I see them as advocates. I see them as multipliers. I see them as force multipliers. They go and talk about it, maybe on your blog, maybe on your Twitter or wherever you can. But that's how you're going to talk about it. Many of the solutions, sir, as you rightly have said, they've come across today. Yeah, lots of information is there. So that's what we're. And the post-hip fracture surgery, I didn't know that, with that even after surgery, the 1-year mortality is 43%. Dr. Prasad spoke about the major cause of disability is the neuro disability and is missed out. Sir, it has been missed out many times. We still look at other areas. You talked about females are 2 times more prone for falls, ma'am. And there are not only biological or anatomical reasons, but also social reasons for that. So we need to really concentrate on our elderly females, our mothers, grandmothers. And so it's a very important thing. And many of the people sitting here are going to, or already in that age group. So that's one point. So your 5 mantras for prevention. I'll call them mantras. And I'm going to spend 45 seconds on them, but you talked about safe home. You showed some of the ways how to make your home safe. There are many other ways, because today's session cannot encompass everything. The purpose you did very well is that you touched upon them. Eye checkups, health checkups. We talked about thyroid, many other things. Very well done. You were able to pull threads from many places and bring up why we should be doing it. Ma'am, sirs, ladies, gentlemen, girls and boys, as one of the airlines says, we may be a literate society, but we are a health illiterate society. I had PG girls and PhD girls, ma'am, sitting there. I'd like to address you. I made a lot of trainings in many parts of country. And there were PhD girls when I was training them on sexual health. That's how I started. And that's how WHO picked me up. My origins are in HIV, sexuality and adolescent health. I have my degree from Lausanne, Switzerland on young people's health. So more than 2 girls at one time asked me, why can't men become pregnant? And I could tell them that, yeah, she was doing a PhD. I could tell them because they don't have a uterus. So her next question was, so what? Why can't they become pregnant? Then I realized, ma'am, that people who are even so-called highly literate are absolutely health illiterates. And that's where your point comes up, how we need to train them, why somebody has to go and get those investigations done. Don't presume people just because they are educated, so-called, that they would understand the relevance of what you're saying. We'll have to continuously, patiently, cogently continue doing this. Next was the stay active, and that you require neuro rehab and AT. A very wonderful way you show the devices of, very interesting way, how small things could do that, especially the one which for the toothbrush and so. I did exactly that for my people for leprosy. I was talking to Dr. Rajgopal, global program on leprosy, which we have in Sero, how to tell them on these areas. And prevention is possible. Dr. Rao, sir, excellent point coming up on design. I think we missed out on that. If we start focusing on AT, we forget the design part that we could actually incorporate in our life. How to make this room, elderly friendly, this table, the chairs. Why should the chairs be always of this design? These are absolutely unfriendly chairs for the back of everyone, not only the elderly. They're badly designed chairs all over the world, but nobody has brought up as a design areas. So the excellent point, Dr. Rao, to bring it up and introduce of the designing parts. Number of technologies for visually disabled, he's told, and I'm myself pleasantly surprised because I work with him very intimately, that more than 200,000 people, users in 35 countries, experience zone, and all are welcome. That brought a lot of cheer to the people here, that when you ask them, and I am sure you're going to have visitors. Amil, you talked about WHO's work. 2.5 billion persons need AT. It's an excellent point, but only 3% or less than that have access, especially what you gave the example of hearing aids, which also Ravinder corroborated very beautifully. So there is something, Ravinder, I'll join you both together. There's something called, as most people call a demand-supply gap. Actually, there is a triad, the need dash demand dash supply triad, which is missing. People don't even know that they need a certain product because they think it's not available. So there is no demand for that. Since there is no demand, there is no supply for that. So what we need to do is create need for the product. And that's WHO's job. Ashil, Hamil, and all of us are doing that. And as you said, leave no one behind. Ravinder, I've already talked about what you talked about, the big gap and the India AP list, how you are struggling, and very rightly so, that it has taken so time that nearly 40 products already become obsolete. Dr. Lala, excellent point. You used less than 1 minute to educate us that prevention is most important. And I'd like to reiterate that to all of you. I think it's a wonderful session to get in 1 hour so much of information in such clear terms. None of the sessions were academic in nature, talking about what is done. So that's laurel goes to you and to, of course, every speaker here, that they give those points which could be easily digested by a non-medical person and that could be transmitted further. So my one request to everyone here is, please don't keep this information to yourself. Find out channels to disseminate it further in many ways. And of course, ask questions now for the next 10 or 15 minutes, whatever is available. Over to you, back to Dr. Rajendra Prasad and the team. Thank you so much.
Thank you for that excellent summary. And I just take one point. You know, that lady, she perfectly well knew men don't have uterus, but she was trying to engage with a handsome young man, right? And she would just use the only tool she could. So that is it.
There is another question, sir.
Thank you all. Wonderful, wonderful session. We must have time, just 2 points. We must address some faculty, and I'm sorry, Mr. Neil, that you were interrupted, but you will have a chance. So please, if there is a question on AP, I'd like Mohammed Will to answer that and answer any of them. And then maybe Patanjali ji or our chairperson can coordinate. Ashok, could you coordinate the Q&A session? No? Ashok. Okay. Good. So direct your questions to the chairperson, please.
Yeah, well, I take only 3 minutes. I'm having that much of information that your problem is almost 90% solved. I'm a vice chancellor of a International University School of Medicine, Michigan, USA. I am a member of this, and I have been looking at Mr. Srivastava, and it was because of His Excellency, the Governor of Jammu and Kashmir. I was forced to be a member. I was not interested to be a member. Reason being, here people come, they enjoy drinks and have meals and gupshup, and this should be a center of sharing of the knowledge, which is not, presently not. I am making him to understand this thing. I am grateful to Mr. Prasad. He has given you a lot of information. Excellent. And I wish that it should be periodically after 3 months or so that we disseminate the natural, the information everybody is having, because the Indian are the most intelligent creatures in the world. In America, the people are mad for the alternative. No, I come to a very simple. I have the data that I have cured 50,000 people suffering from arthritis, and not by giving any medicine, no medicine, no painkillers, nothing of the sort. Simple hot water fermentation at bedtime. No fan, no, AC. Simply a simple hot water fermentation with the methyl element turpentine, almost 20 ml. That is all. I have been suffering severely because of my spine. I was a young boy. Somebody make a jump on my back. It was broken. It becomes like this. I'm leaning to one side, but nobody can judge it. I am cured because of this simple hot water fermentation. This is a simple solution.
Sir, may I say, you're going to put a lot of us out of business. Have some consideration for us. Thank you for your comments. Yes, ma'am.
Sir, I was told 40% of our population is above 60. And genetically, Indians are more prone to osteoporosis. And women in particular are doubly more prone to osteoporosis. So like we have been advised mammography, most of us above 60 regularly. So do you also advise us to go through bone density regularly?
I think bone densitometry evaluation over the age of postmenopausal, once a year, once in 2 years, is actually very good. The myth is that we need vitamin D and calcium. We do not. Calcium is a precipitate salt. It precipitates with everything. You do not need calcium. You need vitamin D, you need proteins. And that is the misnomer that we have. We have abundant vitamin D available in our country. In terms of mammography, pap smears, this is something that everyone over the age of 40, 45 should undergo. And it is the awareness that women's health, men's health, males over the age of 45, 50 should undergo a prostate evaluation. Colon cancer is on the rise. Chest cancer, lung cancer is on the rise. So if we are cognizant of that, dental checkup, how many of us in the room go for regular dental checkups, for instance? So these are all points that we need to sort of inculcate. This all adds to the overall, if you don't have good dentures, you're not going to eat well, you're going to be weak, you're going to have osteoporosis. It's a vicious cycle.
Except when I'm standing and suddenly I move, I turn to move. So I feel, disbalanced or as if I would fall. It sometimes happens, not always, but
You need two things, sir. One is a neurological examination would be good. A spinal evaluation will be good. And also the fact that you should check your blood pressure because you have, like Rajendra mentioned, you have postural hypertension, particularly if you are sitting down or lying down and suddenly you get up, particularly at night, your blood pressure tends to fluctuate, and patients who are hypertensive or even hypotensive, they can have this.
ये कम होता है, but अभी मैंने देखा है कि वो मैं खड़ा हूँ, बात कर रहा हूँ, suddenly I turn or left or right and
Yeah.
go.
A little
I
checkup
feel
is.
I'll be happy to
Yeah.
do that neuro examination
Thank you.
sometime.
May
I-
I was perfectly all right about age 70, no problem. Hypertension, I go to Dr. Kennedy, I take a medical test, check up every year. 70 years ago, my knees gave up. Because they're 40. So Dr. Rajkumar, my God, operation, but then,
So what is your question, sir?
last that came to me, was about 2 weeks ago. But 3 weeks ago, I came to you myself, Dr. Cody took care of me. Vertigo. Now, is vertigo something I have to live for the rest of my life? Or is it something that will go away? I didn't know Dr. Gopal that it's vertigo. I don't know what it is, but I went to the hospital, look any doctor who was there.
Yeah.
Right.
So to answer your question, all vertigos are, do not have to stay for the rest of your life. It has to be identified and treated, but it must be, otherwise it's an important cause of falls. Any other question?
May I? I'm Dr. Mohammed Ashil, I'm the country focal point and NPO for injury and disability prevention.
He's the
WHO.
country head
Yeah,
of
sorry,
WHO for assistive technology. Thank you for coming.
Injury prevention and disability prevention in toto. And my question is directed to Rao sir. Like as Government of India, as we know, is coming out with a national injury prevention strategy in which falls is one of the major things, in which systems approach is taken, and WHO is supporting ICMR and many stakeholders are supporting Government of India, bringing out that, and it's in final stages. One of the main thing that was said in that is safe system approach, is safe and creating safe environment. I was particularly thrilled when you said that IIT Delhi has come out with some safe designs, because we are particularly looking for something. We have to take it from ADA, we have to take it from any other thing. And the harmonizing guidelines which the Government of India have is not very particular to the elderly thing. So have you come out that IIT Delhi has come out with this design, or is something which we can readily refer to? Thank you very much.
I think I'll just add, and maybe Gaurav, if he has a mic, he can do. So, see, there are actually already existing guidelines, even for the elderly, etc. But only thing is, what happens is these vary from country to country because of the anthropometric data and many other.
That's exactly the problem.
So that is the research. So it has to be a little bit country specific, and that's what Gaurav actually does. He's actually trained to do it. He's trained in multiple universities in US for designing for elderly. Maybe you want to add something to that quickly.
Yeah. Right. So on this note, so I'm sorry I've been sort of brought it in the back to say we are 3.5 minutes overtime, and IIC protocol demands that we wind up. So those of you who still have questions, the panelists will be around. They'll be happy
There's
to.
one
And,
online question, sir.
just take one online. Right, can we have one online question, please?
Yeah, so, the question is raised by,
Just speak louder, please.
Gulul, 88. The question is, the fundamental for the prevention of fall as a leading cause of disability at home, making home environment safe. So what are your insight to modify home environments, especially in rural poor housing environment? What are the tricks to improvise the poor setting? Because what have been suggested by the presenter is based on modern and good economy income.
Yeah, I think that's what Gaurav was about to say. Maybe you can finish it off with that answer.
So the quick question, Gaurav can answer. What is the solution in a rural area? So if you could.
Designing.
I think it's very simple. We need evidence-based research, just like medicine in environment and behavior. We need the evidence, analyze it, and then create guidelines and standards. Unfortunately, we are not there yet.
So we don't have evidence, the answer to that. Thank you for the online question. We don't have answers for the rural population, and I think we need to do some research, but it's really important that you have focused that point. We will share the email of everybody with everybody, and it'll be really nice if you can look into that answer. Every contact. We will share that. And now can I invite Dr. Chitra for a vote of thanks, Chitra?
Yeah, sure, sir. Thank you. I won't take much time because we are getting late. On behalf of Kara Medical Foundation and Indian Head Injury Foundation, I am here today to express our deepest gratitude and present a heartfelt vote of thanks. The success of this event was not possible without unwavering support and contribution from so many. First and foremost, I would like to extend my sincere appreciation to our esteemed guests and dignitaries who have honored us with their presence here. Your valuable insights has inspired us, and we are truly grateful for the time you have taken to join us. We would like to extend our gratitude to the chairperson IIC, Dr. Rajpal, the director IIC, Mr. K.N. Srivastava, and all IIC staff for their vital support. So we would be happy to have more collaboration with you for the benefits of the community. A special acknowledgement goes to our panelists, Professor P.V.M. Rao, Mr. Mohammed Amin, Dr. Ravinder Singh, Dr. Tarun Lala, and Dr. Patanjali Nair, whose expertise and passion have enlightened us. We would like to thank the participants and online attendees who have taken time to be the part of momentous occasion. Your enthusiasm, engagement, and active participation have made this event a memorable experience for all of us. And last but not the least, I was told to not take his name because he is the host, so I won't thank him, but I will request everyone to please give him a big round of applause, Dr. Rajendra Prasad. Okay, so we have an anniversary couple here and would like to wish them happy anniversary to Mrs. Sir. आपकी writing बहुत गंदी है. I'm sorry.
Well, before we end, this is the way you celebrate your anniversary. That's really sad. But thank you so much for coming, Mukul and Poonam. Happy anniversary.
Happy anniversary, Mr. Sanwal.
And thank you all for attending, and we'll keep in touch for the next session. Huh? Exactly.